Okay, so now let's talk about anatomy. So this is not an anatomy course by any means, but I do want to talk about some of the things that you should learn if you're going to be applying tape to people. I tell people, applying tape is not an exact science, but it's at least an approximate science, right? You got to know something. So for those of you who work out a lot, you may know a little bit more about the muscles. For my trainers, you know a lot about the muscles. For my healthcare providers, same thing. If you don't know anything, you should really get familiar with your anatomy and your muscle contractions before you make taping a regular thing for you. Okay, so that said, when I talk about function, first of all, identify the region that's hurting, obviously, and then determine what the function of that region is. So what does it do? Does it lift the upper extremity into flexion? Does it extend the wrist? Does it side bend the head? What do these muscles do? Another way to think of this is what movement makes that region achy? That tends to clue you into those concentric contractions of those muscles. Okay, so speaking of contractions, there's different types of contractions. So there's concentric, where the muscle shortens to do work. So it's kind of like doing a bicep curl and pulling the weight up. And then there's eccentric, where the muscle lengthens to do work. The other two, isometric and isokinetic, I really wouldn't worry about too much. Those tend to not be as symptomatic as concentric and eccentric. So just remember, concentric is shortening, so it's pulling towards the body to do work. Eccentric is lengthening out to do work. It's kind of like controlling it down, so to speak. So determine maybe which one of those is more painful or more achy for your, I was going to say patient or client. And then that can clue you into how you're taping, what direction you're taping, because you can then determine what muscles are in that area, where they start, where they finish, which is also called their origin and insertion. And that will help you with the activation and inhibition taping. Now here's why. If I have a shoulder, let's say I have an upper trapezius that is really sore from lifting heavy one day, and I need it to calm down. It's just really, really tight and it's not letting go, and it's achy, and I'm developing these trigger points. I want it to calm down. So I want to help inhibit that muscle. So I'm going to tape from insertion, so the bottom where it kind of finishes, quote unquote, to the top where it starts. So for the upper trapezius, and we'll see this later because this is a taping that we use, it's going to be from kind of on the side of the shoulder, so on the deltoid region, and then you're going to pull the tape up and end the tape up on the neck. So as a result, remember this, wherever you start your tape, wherever that first anchor is, that's going to be your direction of recoil. So that's going to be the direction that the tape is pulling towards. So in the case of the upper trapezius, the concentric contraction is moving from insertion to origin. So it's moving up towards the head. So we're going to do the opposite to inhibit it. We're going to pull everything down towards the shoulder to help it relax. Think of it as kind of stretching out. The last thing that I want to say, and I think I touched upon this earlier, is you've got to determine what your goal is. Are you circulating? Are you activating? Are you inhibiting? Are you stabilizing? Because that will clue you in onto how to tape. And then again, learn as much as you can about that region. What muscles are involved? What joints are there? What makes the patient or client more achy, what helps them feel good, and use that to be your guide. Because like I said too, it's not an exact science, but it is an approximate science. So you've got to know a little bit about the muscles and their function and what's going on in that region if you really want the tape to be effective and helpful for this person.